My name is Philippe Blasco, and I'm a nurse, and currently I'm a nurse coordinator at the ROFSED, which is a network supporting about more than 300 families all over Île-de-France region, so all over Paris, family of children with sickle cell disease. So my main role is to organize education activity, but also to do some kind of coordination of some professionals that are in contact with children, mainly outside the hospital. I have a master degree in public health and also a master in education science, and I'm specialized in what we call in France therapeutic patient education. And I've been working in sickle cell disease for only 2 years, but before that I was working for other chronic disease for more than, let's say, 20 years. It's important to educate sickle cell disease patient because first it's a chronic disease, and like every chronic disease, patient need to be able to manage their disease. For sickle cell disease, they need to be able to manage a pain crisis for the parent, because we are dealing mainly with children and their parents. They need to be able to manage a pain crisis in their children. When they have a fever, they need to know what to do to identify the signs and symptoms where they need to go to hospital. There is a number of things that when you have a chronic disease you need to do. Also, for adherence to treatment, we know that education intervention has an impact on improvement of adherence to treatment. And yeah, that's the main rationale for that. Of course, we have the chance here in Hôpital Necker and at the ROFSED to have a number of educational tools which has been developed by a number of people, by us, but also by other centers. I will say, if you want to start to do therapeutic patient education, I think the main is to have that kind of tool that we call a flip chart, and it's very easy to use. And for instance, for medical doctor, can be used they can put it at the consultation desk, where you have on one side the image for the patient, and at the back the text, the message for the educator or for the one who are doing the education. And for instance, the one we are using it very often. It covers all the issue regarding sickle cell disease. But then there is many other type of tools depending of what you need to address. For children, of course, it's nice to have some game. But for medical doctor, because I will recommend at least to have this flip chart. Yeah, I really enjoy this preceptorship experience. I really enjoy to have all these doctors and health professionals coming from different countries. I think we had a lot of fun, especially this afternoon, looking at all these games for children, and I think people enjoy very much, and we had a lot of fun.